Hello, everybody. Thank you for joining. I'm Dr. Idee Charles, and today's topic is COVID-19 a hoax, or is it a reality? Is COVID-19 a hoax or a reality? So I'm just going to share this on my page and ask people to join us. Bear with us. Welcome as you join. Today we are streaming live on our YouTube page um, due to popular demand because most people. Hello, Joyce. Thank you for joining. Most people prefer the YouTube to the Facebook, so we want to start streaming live on the YouTube page. That's the new development. So thank you, Joyce, for joining. It's good that you found it on time. I'm just trying to post it on the Facebook page so that we won't lose some people who would love to join. So I'm just posting it here on the page. So is COVID-19 a hoax? Is it a lie or is it reality? And that is the topic today, and that is what we're going to be talking about today. And evidence-based why we think it's a false evidence or why we think it's a reality. That is what we will be talking about today. Um, Please join us as we are about to start. You can join us. Is COVID-19 a hoax or a reality? So you can join us. I'm just going to go through again what is COVID-19 infection. I'll go through the numbers, and then we're going to be talking about various questions, commonly asked questions that people do ask, and we are going to go through so many common things. And as we do on the health gospel, we don't go through a lot of big grammar where you don't understand. We try and communicate in a normal way where all of us will understand what we are talking about. That's why I do this program, so that we can communicate together and talk and just talk and rub minds together. Basically, at the end of the day, all of us will get clarity on this topic. So COVID-19, is it a hoax? Are they lying to us? A cross section of the country, especially Nigeria or Africa, a lot of people think that COVID-19 is false. That thing is a lie. They are not telling us the truth. And that is how they have been lying to us. The government are lying to us. They are just using it to make money. It's not true. That infection, that COVID, that corona, no be true, no be true. Now lie. Is it a lie or is it a reality? That is why we are here today. Do you think that is a lie? Do you think it's a reality? And I want you to contribute, say what you think. Do you think COVID-19 is a hoax? They're just using it to make money. Or do you actually think it's killing people? I want to hear from you. I want you to say what you think as you join. Is it a hoax or is it a reality? And I would also lay out my point for all of us to know or to see what we are talking about today. Is COVID-19 a lie? Is it all about money, money, money? Or is it a reality? Are people dying from it? That's what I want to discuss today. Because along the line, a lot of people have said so many things. They've said so many things. Thank you, Linda. Linda said it is real. It is real. That's the truth. But but so many people across the nation, Africa, even here in the UK, people in Nigeria, you hear people saying that thing a lie, then they just use and make money. Why are they lying to us? But I'm going to go through these subheadings today. The first one will be COVID-19, what it really is, how it is transmitted. Then we go to the numbers, even the numbers up until today, the numbers in Nigeria. We go through the spread. It's just to remind us. We go through the prevention. What can we do? Because this is going to stay with us for a long time. So what can we do? Commonly asked questions. What are the questions that people ask commonly? Like example, if if somebody's saliva touches my hand, can I get COVID-19? Or if somebody pools in the toilet and I go and sit in the toilet, can I get COVID-19? So many questions that you cannot ask ordinarily. We're going to be talking about them today. So please invite your friends and let us start. So I'm going to be starting by telling us, reminding us about COVID-19. COVID-19 is an infection of respiratory tract. Is a respiratory tract infection. Is an infection that affects our respiratory tract. It was originally found in China, Wuhan, China, and then it spread and it became sort of an emergency. Then it became a public health emergency. Then it became a pandemic. A pandemic means that this infection is going all over the world. Everybody all over the world has got are likely to have the infection. So that is COVID-19 infection. Is a virus. It's a respiratory tract infection. Is one of those serotypes of the one of the respiratory tract infection. It is very virulent, meaning it can be transmitted so easily, and it is transmitted through droplets. So droplets is like sneezing, coughing, and when it's a heavy droplet. So it's not the one that travels far. It is the one that travels not too far because it's heavy droplet. That is why World Health Organization is talking about us giving this thing now for. That is why World Health Organization is talking about trying to keep 1 meter distance when you are walking, when you are in the shop, when you are out and about. 1 meter distance. That's why World Health is asking for 1 meter distance, because the droplets are heavy and they don't travel far. So if you're 1 meter apart, you can actually not catch it. So it's a droplet infection. You can catch it through somebody sneezing close to you, somebody coughing close to you. You can catch it through surfaces. So if this droplet falls on surfaces of your table or plastics, or in the shop surfaces of the shop, you can actually be transmitted. So if you have somebody coughing on the table or in the shop, and you pass and you're touching the same table at that time, you can actually catch it. The length of time that it can survive right now, up to 72 hours on surfaces. It can survive up to 72 hours. So that is why we talk about the normal prevention things that we are supposed to be doing. Now I'm doing this program because people, when it was really getting worse in United Kingdom, in Spain, in Italy, in Nigeria, they were like, no, it doesn't catch African. Did you see any African die? Did you in Africa, in Nigeria, we are strong. Malaria is protecting us, and all those theories came up. Right now in Nigeria, we have so many people that have died. The only people you hear they talk about are people that are like political figures, people that make sense, people that are holding a high position in the nation. You can hear that they died. Even when they die, they try not to say it's COVID-19. They tell you, oh, they died of complications, they died in the hospital of unknown causes. They don't tell you that it's COVID-19. But so many people are dying every day in Nigeria with COVID-19 infection. So many people that are not recorded. Nigeria does not have a good record of bed certificate, bed death mortality, or any data, biodata of its citizens. So somebody can actually die and gone, and nobody knows that he's dead. So many people have died. I heard as at yesterday, one doctor was struggling for her life, and thank God at least she's still with us, she's still surviving, and she's in Nigeria. So COVID-19 is real. People are dying from it. I have colleagues who've died from it. I've seen people who have died from it. I've also treated somebody who is confirmed COVID patient, right? So it is real. It is a real infection. It is a real occurrence. It's something is happening. It is real. Now, people that are dying, some of them didn't think it's real. Some of them were saying, "Oh, it's not real. I don't believe it," and they die because they were careless with their life. They were careless with the spread. They were careless. They don't want to hear about it. They don't want to know about it. So they become careless. And when you become careless, you can die from it. And that is something that is God does not control. You control it yourself. So you can actually die from it because you are careless. As at yesterday, this is just a Nigerian case. As at yesterday, we had 36,000 confirmed cases in Nigeria. 36,000. You can get the figures are out there. I'm not just confabulating the figures. I'm not making it up for you, but it is there on the NCDC website. You cannot actually see it. So the figures are there. They are there on the website. 36,000 people are confirmed. And these are people that have been tested. So many people are not tested. So many people have not gone through the test. In so many states in Nigeria, they say there's no testing because there's no kit. There's no testing kit because all the monies that were sent, all the monies that were provided, only God knows what they've done with the money. Bless Nigeria the way we are. But now people that need testing are not being tested. So people are still dying. The death rate is 778 people recorded death already from COVID-19. You may want to argue that yes, the government are not being truthful. Yes, the government are not telling the truth. They are not doing this. But the truth is that people are dying from COVID-19. People are dying from this infection. Now, let us look at the numbers across the world. All over the world, we have 14 million confirmed cases from North to South Asia, Europe, North Asia, America, all over. 14,000 million confirmed cases. Out of all these cases, we have almost more than 500,000 people that have died all over the world. And then people are asking, but they say people are not dying from it. Let's go to the numbers. So with COVID-19, we have three types of infections. So if you contact COVID-19, you can present three ways. You can have mild symptoms, and we'll go through the details of the symptoms. You can have mild symptoms, or you can have moderate symptoms, or you can have severe symptoms. If you're having mild symptoms are things like you feel like cold-like symptoms, you cough, you have a bit of a temperature, you feel body aches and pains, and that's it. And maybe after a day, 2 days, 1 week, you are okay. You are fine in yourself. But with moderate infection, you start having more symptoms. You have people that have diarrhea and vomiting, and you have people that have what's going on here? You have people that have diarrhea and vomiting. You have people that have lost their taste. They can't feel anything anymore. They don't feel the feeling of taste. They have diarrhea, abdominal pain, aches and pains. They have high temperature, sore throat, coughing, and they have a little bit of respiratory problem, meaning shortness of breath. They can't breathe properly. So their breathing is labored. And these people can just go through the stages and they become okay and they are well. The third stage of people are the people with severe infection. Severe infection are the people that their respiration, their breathing is compromised. They are struggling with breathing. They are struggling with breathing. They cannot breathe. They need oxygen. These are people that need admission and they need oxygen. They might even need a ventilator because their body needs oxygen, they are unable to breathe. This class of people are under the severe form of COVID-19 patient, people who have been affected. And this class of people are people that are 1 in 5. So 1 in 5 of patients, people that have COVID-19 will actually have severe form of it. The rest will have either mild or moderate. The severe form of COVID-19 are people who are struggling with their breathing and they can die. Now, out of the severe form of COVID-19, there are people who their body will actually not cope with what is going on and they will die. Somebody will ask me, but they say if I'm healthy, I don't have COVID-19. I'm going to answer that question. That COVID-19, yes, it is higher. The risk of dying and having severe infection is higher in people who have comorbidities. So people who have things like asthma, people who have hypertension, diabetes, people who already have breathing problem like chronic obstructive airway disease, people who have chronic kidney disease, people who are suffering one form of problem that affect their immunity. This type of people, if they have COVID-19, they might come down with very severe infection. Now, the younger people, the people who attempt to be healthy, are people who the society say, but they say if I'm healthy, I will not have COVID-19. But it has been confirmed that COVID-19 has affected people that have been well, they are healthy, they have no medical problems. And these are people that are very healthy, but they have died from COVID-19. We have questions like, but they say it doesn't affect children. It is recorded and there are evidence that children and young people have actually had COVID-19 infection. The worst still is these people, these young people, these children are people who naturally will not have severe forms of infection, but they are spreaders. They spread the disease. So they can be jumping around, having a little cough, but they are spreading the disease. They are spreaders. If you as an adult are in contact with these children, you can actually get the infection and it can actually become serious with you. But the child is having very mild symptoms, but he or she is a high spreader. She's spreading the infection highly in the family. So that is the danger of even exposing the children to this infection, because they can have the infection, but they are spreaders. They spread the infection, and when they spread the infection, you are the one at risk to get it. So that is for the spread. Now, among the community, we have young people, we have people without problems who will have this infection, but it's mild to moderate. But amongst this community, a little percentage of them will actually have COVID-19 and die from it. And remember in Nigeria that you have to call all these centers to get you into it. Some of them, before you get into it, or you are having problems, before you get into the hospital where they can admit you, because it's not all the hospital that will admit you. If care is not taken, you can die en route. A lot of people have died looking for which facility that would take them in. A lot of families have lost loved ones going from one hospital to the other, begging for people, begging for the hospital to admit them. admit them, to take them in, but the hospital have not taken them in. So then you have people who are on the road looking for people to take them in, and they actually die looking for a hospital that would take them in. So that is the problem. That's the challenges that we are having. It's not something we should play about. It's not something we should wish away. We should think that it's not there, because real people, real family, real husbands, real wives, real mothers, real fathers are dying from COVID-19. Even as we speak now, they are dying from COVID-19. So I was asking which age group is affected with COVID-19. Any age group, from a child to elderly. Elderly people are more at risk because their immunity is low, and a lot of them are living with already medical conditions, so they are at higher risk. But notwithstanding, younger people still have the infection and can still die from the infection. So that is the spread. That is the numbers across Nigeria. We are seeing more than 30,000 people already confirmed. And these are just a small number because so many people are not being tested. So many people are dying without being tested, without being even treated. As we speak, a lot of people are dying in Nigeria without being tested. The numbers are rising every day. Yesterday, over 600 confirmed cases, and this is just a pocket of people that have been tested. Yes, there's a COVID-19 funds which was sent out, and what those funds were used for, I don't know, because it didn't get to where it should get to. A lot of inefficiency. That doesn't negate the fact that COVID-19 is real. That doesn't stop the fact that COVID-19 is real, and people, we should all take precaution. We should all take precaution. So let us go now and start looking at the symptoms. I talked about having respiratory symptoms, something like you're having catarrh, you're having cough, you're sneezing, you have a sore throat, you have a high temperature. And when you have a high temperature, you are coughing, you are highly a possibility of having COVID-19. And then you have aches and pains. So your joints are the joints of your body are hurting you. The joints of your body are hurting you. You lost your test. You cannot test food. A lot of people with COVID-19 says that they test metallic. The test is testing like metallic test. That's the way they feel. Some people feel that they don't feel anything, and when they eat, it's as if they are eating sand. They are eating like something that doesn't have any taste. And then people have dark urine. They are just continuously peeing dark urine. They feel very, very weak and lethargic, very weak in themselves, very lethargic in themselves. And that is a major loss of taste is and smell is one of the major symptoms of COVID-19 now. High temperature, sore throat, cough, loss of taste, and smell is one of the major symptoms of COVID-19 now. So if you have all the symptoms, you remember that you have COVID-19. We go down to bigger, so severe symptoms. Severe symptoms are things like breathing difficulty. So you are unable to breathe. You are unable to breathe. You can try to breathe. You're struggling with your breathing. And at that stage, you really need to get to a facility where they have oxygen, where you can be oxygenated. So these people do not think, oh, I'm going to have a mild problem, because it might not be a mild problem. Your problem might degenerate to become a severe problem. Your problem might degenerate to become a severe problem. Now we are moving from the symptoms. What other symptoms can we have? Diarrhea. A lot of people with diarrhea. Actually, the patient that I saw had diarrhea and vomiting, and we thought she had gastroenteritis, which is infection of the bowels. But it turned out that she had COVID-19. She had diarrhea and vomiting, and it was very severe. So we thought that she had um, just normal stomach bug. but it turned out because she was quite unwell. The striking thing with her is she couldn't breathe. Her oxygen was very low. So I was thinking, why would her oxygen be so low? Why, just with diarrhea and vomiting, why is her oxygen so low? But the trouble was that the virus has already got to the lungs and it has already blocked off the lungs. That's just why her oxygen level was very low. So she was a confirmed COVID-19 patient with just diarrhea and vomiting. No temperature, no cough at all. She just had diarrhea and vomiting. And that can present that way. But at the end stages, you start struggling with your breathing. And before you know it, you are dead. You are gone if you're not in a facility that can look after you. Prevention. Now in Africa, the spread is getting, though it's slow, but it's progressing. Though it is slow, it's progressing, it's getting worse every day. It started even around March, you see, as it's slowly growing. Why? Because number one, the documentation is wrong. We don't know how many we are even. We don't have records. People that are in the villages, in the towns, nobody knows what they have died from. People that couldn't get into hospital, they struggle at home and die. Nobody knows them. It is not recorded. So you see the numbers, even as it is scary, but we don't have the right numbers. So people are dying every day. We have heard people who have actually died. So these are not times that I would personally, or anybody that you know should personally wish away or say this is one of their lies. It's a political agenda. It is a 5G stuff. It is a new world order and all this myth. It is a time that we open our mind and learn and see how can we get through this without dying from it. So we go into prevention and we talked about the mode of spread, which is by droplets from our nose, sneezing, coughing, droplets infection, but they are heavy droplets, so they don't travel too far. So that is why we are all required to wear our face mask. Face mask is not worn on the mouth. I see a lot of Nigerians across the board, even the big horns, the big guys, they are wearing mask only covering their mouth. Their nose is open. Face mask is supposed to cover the nose, the mouth, the chin. And you're supposed to get a mask that have something that you can mold onto your nose that can actually block off the space. But a lot of the masks that we are seeing are fashionable masks, which is okay, but then they are not doing the purpose because here is open, here is open, here is open. The mask is supposed to be nicely on your face, cover your nose, your mouth, and your chin. Because if somebody sneezes close to you, if somebody coughs close to you, all those spaces have already been sealed off, and it's highly unlikely for those droplets to get in. Now I see people when they wear the mask, they touch it, they remove it. But it's all rubbish. We have to know how to wear mask. It's not just wearing the mask on, oh, I've got the mask on. It's actually knowing how to wear the mask. You have to know how to wear the mask, how to cover yourself, how to get it all in the right place. It's not something that you play with. It's not fashion, it's a prevention. So it's not something just show me this thing that you carry and put to match. It's okay, but make it to be fit for purpose. Make it to make sure it's sitting on your nose, it's covering your chin. That is how to wear it. And when you wear a face mask, please don't take your hand and touch the mask. Don't take your hand and touch the mask. You have to be able to not touch your mask with your hand and then use it again, because all the droplets are on the surface of the mask. You take it off from your ear side, from the back, and then wash it. If it is reusable, you reuse it. That is a must. Then the washing of the hands. You have to wash your hands. We cannot emphasize it enough. You have to learn to let it become part of you, to wash your hands, to use hand sanitizers. Let it not just be a thing that was invoked last month and this month is no more. You have to learn to wash your hands regularly. When you're out and about, when you are in the shop, you use hand sanitizers. When you get home, you wash your hand. You wash your hand off, and the products you've brought in, you clean them and you put them away. That is one of the prevention. Washing of hand sanitizer, face mask is very important, and keeping the 1 meter distance. If you don't need to be in a crowd, please don't go to a crowd. If you don't need to be in that place, please don't go. It is still very, very contagious. It's still there. If you don't need, I've said it this 2020, this 2020, if you don't need to be in a place, don't go. Just learn that I want to survive. Just learn the preventive measures and follow it. If you don't need to be in a gathering, don't go. If you're in a gathering, keep the 1 meter distance. Let it stick to your head. Let it stick. Let it be part of you, because that can just be what will protect your life. And let me explain. Your friend can have COVID-19 asymptomatic, meaning he has no symptoms at all. He has nothing. But the other person can have COVID-19 and become symptomatic and even die from it. So why would he die? Because when you have this virus, it gets into your body. The number one, the virus itself fights your immunity and try to suppress it and take over. So it takes over and multiplies and multiplies and multiplies and takes over. The second thing that can happen is your immunity, your immune system begins to react to fight this infection. And there is a war, like a mini war going on in the system. And when this war is going on in the system, what happens is your system can then begin to be affected. You know, they say when two elephants fight, the grass suffers. So when your immunity is reacting, trying to defend you against this virus, and the virus is attacking your immunity, there is battle. So your body can go into a state where things are beginning to go wrong. Your system is failing, your organs are failing. And this is one of the major things that are happening to people. So they have kidney failure, they will need dialysis, their liver breaks down, they have multi-organ failure because their immunity is trying to fight the virus that is coming in to attack and take over. So some people go into a really bad state, their organs fail, and they need life support, they need oxygen, they need dialysis, they need support to live. And if you get to that point, you might die. If you're in Nigeria, you might die, because before they get you around to find where to put you, you might die. So we have commonly asked questions. Why do I need a face mask? I have explained why we need a face mask. It's very, very important. The face mask, very, very important to get a face mask. Very, very vital. Let it be part of you. Let it be part of your family, your children. You all need face mask to get out there. You all need to learn to wash your hand. You all need to learn to use hand sanitizer. You all need to learn the hygiene. A lot of us didn't know how to go about personal hygiene. This is the time. Cultivate the habit of bathing, washing your hand, using sanitizers. Cultivate that habit. Is very important because COVID-19, especially in Nigeria, is growing. People are dying from it. People are getting very sick with it. So we have, what about if I have a dead relative who had COVID-19? What should I do if I had a dead relative who had COVID-19? Good. There is no evidence that there is a virus in a dead body's fluid. There is no evidence that the virus can be transmitted from a dead body to yourself. No evidence. That's from WHO, World Health Organization. In the time of Ebola, there was evidence. So the dead bodies were always really, really highly contagious. But in the time of COVID-19, there's no evidence supporting that. They said, though, if I have a dog or I have a cat, will I have COVID-19? Will I pass it to the cat? There is no evidence that there is a COVID-19 transmission from the animal, your domestic animal, to yourself. No evidence. So if you have COVID-19, there's no evidence on your cat that you're going to give it to your cat, or your cat is going to give it to you, or your dog is going to give it to you. There's no evidence like that. And somebody is asking, if my relative has COVID-19, how do I care for them? You need, if you're a carer or you're a healthcare worker, you work in the hospital, you are the ones that need the N95 mask, or you need the FFP2 mask. But what I see in Nigeria, the politicians are wearing the N95 mask and the FFP2 mask, and the people that need it, which are the healthcare workers, are wearing ordinary mask. They don't need the N95 mask. The politicians don't need it, except they are working in a highly infectious environment like the hospital. They just need ordinary mask. So please, politicians in Nigeria, hand over the N95 mask to the people that need it, which are the healthcare workers. Hand over the FFP2 mask to the people that need it. You just need normal mask. The people that need the mask are the health workers, people who are caring for people that have COVID-19. If they have a relative that have COVID-19, they need the N95 mask or the FFP2 mask. But you people take all the masks as politicians and wear them, and then allow the healthcare workers to die. That is the wrong thing to do, and that is something that you need to correct. And then when you wear the mask, you only cover your mouth, you don't cover your nose. And you're sneezing and coughing. What's the point of wearing the mask when you only cover your mouth? You don't cover your nose. People will be walking around with only mask down in their chin. Or when they want to talk to you, they remove the mask. Why? It is to cover the mouth when you're talking, so that the droplet do not transmit to another person. It's not fashion. And then when you want to talk, you pull down the mask. After talking, you pull it back up. That's all the wrong things that we are doing, and we have to correct them. So we cannot continue seeing people, they wear masks, and then when you ask them a question, they pull down the mask. No, put your mask up and wear it up. You don't need to put the mask down. The mask stays up. Cover your nose and your mouth. People ask about toilet. So if I go to the toilet that somebody that had COVID-19 had gone to, will I have COVID-19? The answer is no. You will not have COVID-19 from toilets. Somebody asked, if my husband has COVID-19, if I have sex with my husband, can it be transmitted sexually? The answer is very, very low. They didn't find very trace. It's only trace that they found in semen. But at the time that the man or is very sick, how is he going to even be able to have sex? He's very sick. So by the time the man is well, there's no more virus in his semen. So it is not transmitted, it's not sexually transmitted, because these are questions that people are asking. So it is not sexually transmitted. It's not transmitted by toileting, fecal matter. It's not transmitted by your animal. It's only transmitted by droplets, infection, droplets from sneezing, from coughing. Now we go into, so what is the way forward? Is what I've described, is what I've said, is what we are talking about. So how is it not going to go away? Is it going to last forever? Nobody knows, because the infection, it keeps going around. People are not keeping to the rules. People are not wearing face masks. People are not keeping the 1 meter distance. People are not washing their hands. So unfortunately, the infection keeps going around, keeps reinfecting other people. So the infection is getting worse, especially in Nigeria. It's not getting better. So the thing for you to do is to take it upon yourself, to educate yourself, to prevent it from happening. So by wearing and following the simple instructions, making it part of your livelihood, making it part of your life, Don't just make it to be a season, one day thing. Make it part of your life, that this is what it is going to be from now forward. I have a face mask. I wash my hand. I keep a 1 meter distance. If I don't need to go anywhere, I don't go. No matter how they're threatening me, because I see so many people on social media calling themselves men of God, threatening people, threatening them for tithes, because churches are not opening or people are not going, as the crowd is no more there. So their pockets are getting dry. And now they're even cursing people. Your heaven will be closed. You are cursed. You can't be a tithe. Everything will be tight with you. Your financial life is tight. These are all rubbish. Protect yourself. Leave these people. It's hunger that is worrying them. Money is getting down. So they are becoming irritable, agitated. Because if this thing goes longer, they are going to go bankrupt. So they have to use the same method they have been using on you people. If you don't pay tithe, your financial thing will die. You will be banned. In short, heaven will close the gate against you. You cannot survive. It's all lies. Lies, lies, lies. Do not believe them. They are lying. Just follow the instruction, because if you contact COVID-19, bring it into your family, husband, wife can die, and you leave your children orphans. So you have to, first of all, talk to yourself and get sense for yourself. Forget about the conspiracies. Get sense for yourself and talk to yourself first. People ask, what about antibiotics? Doctor, what about anti-malaria? These are things that there is no evidence to support that they actually help people that have COVID-19. Some of your symptoms may be malaria, and you take anti-malaria and you're okay. But people that have suffered with COVID-19, there's no evidence saying that taking anti-malaria will cure them or will help them, or taking antibiotics. If you're taking lots of all this medication, you are damaging your kidney more. You are damaging your kidney more. So there's no point taking medication that is not helpful to you. You say, I'm helping, I'm trying to protect myself. You take all sorts of herbs. Remember that kidney failure, which I'm going to do on this channel, kidney failure is in stages. And the only time you will discover that you are already in stage 5 or end stage kidney failure, by then it's too late. You need either dialysis or kidney transplant. So know what you are putting in your body and know what you're giving to your kidney, because when it can't take anymore, it's going to begin to fail. So we now say, so what can we do? There's only 2 ways. Either we find a cure or we take vaccine. So where are the vaccine? The vaccines, there are so many people developing vaccine. There are some of them, they are all in trial stages. Some of them have gone far, almost to the completion, and some of them are still in initial stages. So we are praying that vaccines will become available, just as you had your poliomyelitis vaccine, oral polio vaccine, you had measles vaccine, we had a hepatitis vaccination. This will be like one of those vaccines. Already, people are already beginning to poison your mind again. Vaccine. Ask yourself, did I not take oral polio vaccine? Did I not take tuberculosis BCG vaccine? All of us have the scar of BCG. Did I not take vaccine against hepatitis? Ask yourself, have my children not taken vaccination, all the childhood vaccination, yellow fever vaccination? Have I not taken them? So if this comes out and we need a vaccine to help you so that you can live your normal life, don't let anybody lie to you that this is a mark of whatever they call it, because that is pure, stark ignorance speaking. Because as far as me and you know, we've all taken vaccine, which has helped us to live. We take meningitis vaccination. We've taken all forms of vaccination. When you're pregnant, they even give you more to protect you and the baby. So do not let anybody lie to you. If this vaccine comes out, it is a good thing. We need to take it so that our lives can go back to normal. So is COVID-19 a hoax or is it reality? Now we've learned, we have again learned today, we have reminded ourselves today that COVID-19 is still amongst us. It's a virus, it's transmitted by droplets, droplets, secretions from the nose, from coughing, from sneezing, and if you're in contact with somebody who has it, you will have COVID-19. Your symptoms can be mild, moderate, or severe. It depends on your body, and it doesn't matter whether you have comorbidities or you're elderly or you're young. You can have severe infection. Let us not pretend that this is just a hoax, this is just a conspiracy, this is just political. It is not. People, real human beings are dying from it. Real people have lost loved ones. So going forward, we need to protect ourselves. We need to protect our loved ones. We need to go out there and also help to talk to your family, talk to your friends about prevention. And face mask is now the way out, because when you're out and about in the market, and you are close to one another, you need the face mask. It's very important to protect yourself. It doesn't cost you anything. Wear the face mask. When you get out of that market, wash your hand or use a hand sanitizer. Those may just be the little things that you need to protect yourself, to protect your family. Because when they are carrying you about from one car hospital to another, begging them to take you in. There is a man that died, a highly placed man in the north, because there was no hospital to keep him. Everywhere rejected him. Where they asked him to go finally was miles away. By the time he almost got there, he gave up, he died. So anybody can die. So that is somebody who has all the money, who has cars, drivers. He couldn't get help. What about you who don't have what that man had? The access to cars, to drivers, to money. So you can protect and prevent it from happening instead of allowing it to happen. Don't let all these men that are shouting, COVID-19, you need to come, you come to the church. They are looking for money. Their money is going down. I'm begging you to use your sound mind and live well so that you can live well. Let us live well and go through this period by ourselves and protect ourselves and protect our loved ones. I don't want to take much of your time today. I don't even want to take a lot of time today. But I came out here to remind us that COVID-19 is real. I came out here to remind us to prevent it by following the simple instructions. I came out here today on the YouTube channel to talk about COVID-19, that it is real, especially for our African brothers and sisters and our community, that it is getting worse, especially in Nigeria. Every day we are having more cases. There's no more testing. The money has been squandered. The money is no more. The testing kits are gone. So you are left on your own. What you need to do is follow the simple precaution, simple preventive measure, and protect yourself and protect your family. That is what we have come to talk about today. That's what we have come to do today. So thank you so much for listening. Please subscribe and like. And because next week we are going to be doing another topic on the YouTube channel. That is another topic next week. I'm not going to tell you what the topic is, but it's going to be a very, very important topic that we need. So thank you so much, guys, and stay blessed.